When it comes to weight loss, we often think of diet, exercise, and maybe even some supplements. But in recent years, weight loss medications have taken center stage in conversations around obesity and metabolic health. As science advances and obesity becomes an increasingly pressing global health concern, medications like GLP-1 receptor agonists, semaglutide, liraglutide, and tirzepatide have revolutionized the way we think about managing weight. But what exactly do these drugs do, and how do they impact the metabolic system beyond just shedding pounds? Let's dive deep into the fascinating world of weight loss medications and how they intertwine with our metabolic health. Obesity is no longer considered simply a matter of willpower. It's now widely understood to be a chronic, relapsing disease involving complex interactions between genetics, hormones, environment, and behavior. Weight loss medications aim to work with the body's natural regulatory systems to correct the imbalances that drive weight gain. For example, GLP-1 receptor agonists mimic the effects of the natural hormone glucagon like peptide-1. This hormone plays a vital role in glucose regulation, insulin secretion, and most importantly, appetite control. By enhancing feelings of fullness and delaying gastric emptying, these drugs help people eat less without the constant struggle of hunger. But their benefits go far beyond just reducing food intake. One of the most significant impacts of GLP-1 drugs is their effect on insulin sensitivity and blood sugar levels. For people with type 2 diabetes, these medications can improve glycemic control significantly. But even for non-diabetics, improving insulin sensitivity means reducing the risk of developing metabolic syndrome, prediabetes, and full-blown type 2 diabetes. This is where the connection between weight loss medications and metabolic health becomes critically important. Let's talk numbers. Clinical trials of semaglutide, a weekly injectable GLP-1 receptor agonist, have shown average weight loss of up to 15% of body weight over a year. Tirzepatide, which combines GLP-1 and GIP receptor agonist actions, has demonstrated even more dramatic results with average weight losses approaching 20%. These are numbers once only achievable through bariatric surgery. What makes these medications game changers is not only their efficacy, but their growing accessibility. They're now being prescribed not just for diabetes, but also for chronic weight management in individuals with obesity, or even those who are overweight with certain health risk factors. So what happens metabolically when we lose that kind of weight? It's not just about aesthetics. Weight loss, especially when done through mechanisms that also support hormonal balance, can profoundly improve markers of metabolic health. Blood pressure often drops. Cholesterol levels improve, especially LDL and triglycerides. Inflammation decreases. The liver fat that drives non-alcoholic fatty liver disease begins to disappear. Insulin resistance, which underlies both diabetes and polycystic ovary syndrome, starts to reverse. Even sleep apnea symptoms can lessen as excess weight around the neck and chest is reduced. These changes are not superficial. They are deeply metabolic and can add years to life while improving the quality of that life. But what about safety? As with any medication, weight loss drugs carry risks and potential side effects. The most common include nausea, vomiting, diarrhea, and constipation. These effects usually decrease over time as the body adapts. More serious but rare risks include pancreatitis, gallbladder disease, and kidney issues. There are also concerns about the long-term effects since many of these drugs are relatively new. However, in controlled settings under medical supervision, the benefits for many patients far outweigh the risks. Doctors often start patients at low doses and gradually increase them to improve tolerance. The question that often comes up is, do you have to stay on these medications forever? That depends on the individual. Just like with blood pressure or cholesterol medication, some people may need to stay on them long-term to maintain the health benefits. Others may use them for a time as a tool to help make lifestyle changes more effective, and then taper off. Studies have shown that stopping the medication usually leads to regaining some or all of the weight, indicating that the drug was addressing a chronic imbalance in appetite regulation. This suggests that for some, long-term use may be necessary, similar to how other chronic diseases are managed. But it's important to remember, weight loss medications are not magic bullets. They work best when combined with lifestyle changes such as improved diet, regular physical activity, stress management, and good sleep. What they do is level the playing field. For many people who struggle with obesity, the deck is stacked against them due to genetics and hormonal dysregulation. These medications help bring their biology back into balance so that their efforts produce real, lasting results. And that is a major leap forward in how we treat obesity, as a disease, not a personal failure. As we look to the future, research is expanding rapidly. New weight loss medications are in development that may work even better or have fewer side effects. Scientists are exploring how combining different hormones like GLP-1, GIP, amylin, and others might optimize weight loss and improve metabolic function. There's also a growing interest in how the gut microbiome, brain chemistry, and genetic factors interact with these drugs. Personalized medicine may eventually tailor weight loss treatments to each person's unique biological profile, maximizing effectiveness while minimizing side effects. Insurance coverage is another evolving aspect of this field. Initially, many insurers did not cover weight loss medications, viewing obesity as a lifestyle issue rather than a medical one. But as the science has become undeniable, more insurers are beginning to offer coverage, particularly for people with obesity-related health risks. This shift could make these medications accessible to millions more who need them but couldn't previously afford them. Employers and governments are also starting to recognize the cost savings in the long run: reduced diabetes, fewer heart attacks, less cancer risk, if we treat obesity proactively. It's also critical to discuss equity and access. While these medications are transforming lives, they are still expensive, and many marginalized communities may not have adequate access. This raises ethical questions about how to ensure that everyone who could benefit from these medications can actually get them. Healthcare providers must work to make treatments equitable and inclusive, not just available to the wealthy or well-connected. There's also a psychological side to this conversation. Many people who have struggled with obesity for years carry deep emotional scars. Shame, self-blame, and stigma are common. The idea that medication can help, not because someone is weak, but because their biology needs support, is a powerful message. When people see results, feel more energetic, sleep better, and regain confidence, the emotional healing can be just as profound as the physical changes. Mental health and physical health go hand in hand, and weight loss medications, when part of a compassionate, holistic approach, can change not only bodies, but lives. It's also worth mentioning that weight loss medications are not for everyone. People with certain medical conditions or on certain medications may not be good candidates. That's why a medical evaluation is essential before starting any weight loss drug. Doctors will often look at your body mass index, health history, lab tests, and other factors before recommending a specific medication. It's a personalized process, and the best results come when medication is part of a broader plan that includes support from dietitians, exercise coaches, and mental health professionals. In summary, we're entering a new era of obesity treatment. For decades, people have been told to eat less and move more, often without success. Now we understand that for many, obesity is not just a matter of choice, it's a matter of biology. Weight loss medications are helping to correct that biology and are opening the door to better metabolic health, lower disease risk, and longer, healthier lives. These drugs are powerful tools, not quick fixes, and when used wisely, they can make a tremendous difference. The key is to stay informed, work with a trusted healthcare provider, and embrace the idea that getting help is a sign of strength, not weakness. Weight loss isn't just about looking better, it's about living better, thinking clearer, and feeling healthier. And as science continues to evolve, so too will our options for transforming our health from the inside out. Thanks for watching the video.